World Health Organization is warning about a dramatic increase in dengue fever around the globe, including nearly 2,900 Americans infected this year. That's nearly 5 times last year's rate. Chief Medical Correspondent Dr. Darien Sutton is here. What's going on?
Good morning. These are unprecedented biological times. Numbers not only increasing here in the United States, but around the world. If you look at some of these numbers, more than 10 million cases globally. George, that's more than twice the number that we saw last year. And reasons why: we've got more flooding, we've got extreme record-breaking heat, and then more international travel that allows mosquitoes to thrive and many people to come home with these infections. And the highest numbers, as you saw from that earlier map, in places like New York, most associated with travel, and in places like Florida and Puerto Rico, most associated with mosquito bites. It's important to note that this is not contagious from person to person. The main route is from mosquito bite to person.
What are the signs and symptoms?
So it's classically called break bone fever, and that's because it includes fever and pain so bad that it feels like your bones are breaking, muscle aches and body aches, as well as a rash, nausea and vomiting. And George, it can become severe with severe eye pain and even bleeding.
And treatment? The
treatment is mostly supportive, treating from the comfort of your own couch. Especially for the majority, it's going to be mild. Treating hydration, taking medications like acetaminophen, the active ingredient in Tylenol. An important note here is that you want to avoid ibuprofen or aspirin if you're treating this infection or suspicious, because that can increase that rare risk of bleeding. And then the main thing is prevention. You want to prevent areas where mosquitoes can multiply. You want to get rid of standing bodies of water in planters and empty tires, protecting your clothing and even your skin with insecticides, especially if you're going to go for something like a hike.
Okay, Dr. Sutton, thanks.